Told you earlier that Nigeria has now received more than 800,000 doses of the R21 Malaria vaccine out of 1 million expected doses, making up the first batch of the vaccine. I'm joined now by Executive Director, National Primary Healthcare Development Agency, Moyi Aino. Mr. Aino, thank you for joining us on the news tonight. I was asking you earlier about how much of a game changer this would be for a country known to carry perhaps the highest malaria burden in the world.
To be here, and I apologize for the initial tech connectivity glitches. So this week was very pivotal in Nigeria's fight against malaria. I think due to the leadership of the president and the coordinating minister for health and social welfare, Nigeria is one of the very first countries to get access to the malaria R21 vaccine. There is a suite of interventions that we use to fight malaria. And you are right, Nigeria has a very high burden of malaria. There are parts of the country that are even worse than others. So we got our first consignment of 846,000 doses this week. And it will be in addition to existing interventions like use of insecticide-treated nets, but also seasonal chemoprophylaxis, which is periodic treatment, preventive treatment of vulnerable people. You know, in addition to those, this vaccine really became changing because when you combine it strategically with some of these interventions, you get upwards of 90% protection.
Well, we now know that Kebbi and I think Bayelsa will be the first to get the vaccines. But in terms of storage and distribution, do we have the capacity, and what's your agency doing to ensure that these vaccines remain at the required temperature?
Absolutely. Nigeria is not new to administration and management of vaccines routinely. We have a very robust routine immunization program, and in fact have very recent successful experience of introducing new vaccines. The human papilloma virus vaccine was just introduced from the end of last year to about the mid of this year across the country. And we have the infrastructure in place. We have a national strategic cold store, which in fact is where the consignment was received. From there, it's going to go to zonal cold stores using temperature remote monitored vehicles that will transport the vaccines, and we monitor remotely the temperature to make sure there is no excursion outside of the recommended range. When they get to the two states as well, there are state cold stores where they will stay, and then there are mobile devices from inside which they will be moved from one point to the other. So we have a very robust system for managing cold chain for vaccines, and we actually do use remote temperature monitoring devices to track so that when there is a risk of excursion, we are able to intervene very quickly.
So what we have now is about 800,000 doses out of 1 million for the first batch, courtesy of Gavi, UNICEF and WHO. How soon are we getting the rest, and do we expect some more batches before the end of the year? Some have said that for full coverage and to secure herd immunity, Nigeria will have to start budgeting for its own vaccines.
I think it's very important to say that the vaccine is a relatively scarce commodity at this point. Nigeria is fortunate to be one of the countries getting access. So when you don't have enough, depending when we have enough, we decided to prioritize Kebbi State and Bayelsa State. This due to the disease burdens, in both of those places, like you have said. We hope to learn from that. When it's also an expensive vaccine, so we want to make sure we deploy it in the most cost-effective way possible. So we will learn from that while working with our partners to plan a scale-up to the rest of the country. So the specific timing for that, we do have a tentative plan, but the idea is that's subject to our credibility globally, but also to the lessons that we learn in terms of how best to deploy this to maximize the acceptability to the people and make sure that we get the maximum value out of it.
It's a good place to leave it. We'll continue this conversation subsequently. Moyi Aino is Executive Director, National Primary Healthcare Development Agency. Thank you for talking to us tonight.
Thank you very much.